We're good. Start it up. Hello, everyone. Dr. Rob Kiltz and Dr. Fayez Faruqi
Hello,
live.
everyone.
Hello, Gigi. Let's see. MT 2016 Escobar. And hello to everyone. TS Dolorosa. How are you guys? Welcome to the live. Let's see. From everywhere. It's Fertility Care from everywhere, but it's the Fertile Fireside Chat. As you can see, we have a little bit of fire in the background, upstate New York. I'm healing up from my hernia repair last week and to be back some this week, but it is technically my vacation and fully back on the 23rd. Andrea, Trishi, Boo, hello, Tyra, Carly,
Yeah.
Melissa, let's see.
Robin Lee, Ashley,
Sharmistra,
Melissa, Stream Ward. Is it StreamYard?
Noble Jack, Consul Dr. Mag last week. Awesome. Getting ready for the start of the process. Our Colorado team, Dr. Mags and Dr. Fink. Hello, Mary. Hola, Mary. Let's see. Injin. Hello.
Injin Mom.
Whitney. How are you guys doing? Welcome. We're going to talk about fertility, inflammation, immunology, diet, Kiltz's keto craziness. We'll talk about Montreal. Sarasota is coming with Dr. Condor. We're excited about that. Let's see. Tammy Delph. Let's see. My transfer failed on the 31st. Any advice for the next transfer? Let's see. Family Building Guide. I don't have it right here, but go to Amazon. Look at the Family CNY Fertility Family Building Guide. A lot of good advice. You got to reduce inflammation inside the Ferrari machine. What about laparoscopy and endometriosis? Any thoughts on that, doctor?
Well, if you keep failing, that's definitely something we're going to have to start considering. There really isn't a really good test for endometriosis short of a laparoscopy.
Right. The Receptiva DX may be helpful, but if it says you don't have it, about 20% of people still have it. And then you either treat surgically or the medical approach with all of that. So those are things that to consider. How long after laparoscopy can I start an IVF cycle?
Not very long. As soon as you can recoup from the surgery, usually.
Yeah, a couple of days to weeks is all you need. You don't need to wait months at all. No. We will be doing IUIs coming up in Sarasota, probably September, October. We're going to be monitoring first later this month, but in September for sure. And then adding IUIs, and then later in maybe about 6 months, hopefully adding IVF also. Escobar, low AMH, low vitamin D, low progesterone, normal estrogen and FSH levels. So likely there's a lot of inflammation. There's a lot of damage in the bowels that's chelating your minerals and vitamins that are affecting your ovarian reserve. And so this is where Kiltz's Keto Lifestyle comes in. Check out our book on Amazon or on our website. It can be very helpful. Don't forget our molecular fertility supplements can add to that. But my bet is you got to reduce the inflammation that is likely the biggest culprit in causing all that stuff. So more fast. How much does it cost for an IUI cycle? So IUI may run $600 to about $1,200. You may have some insurance coverage for ultrasound monitoring. And then you're looking at the IUI for about $600. You have to check with our financial people. So
and it's covered in Montreal, and it's not covered in Toronto, but it comes to about the same price.
Let's see. Erica Smith. My only embryo is a high mosaic. Thoughts on mosaics?
Most mosaics are actually normal.
Yeah.
It
depends where you biopsy it, right?
Yeah. There's that. It's exactly like that soccer ball right there. The problem is we never biopsied the actual embryo. We're biopsying the cells around the embryo.
The trophectoderm, right?
Yes, because if you biopsy the embryo, we're going to actually damage it, and then we're going to lose the embryo. So mosaic means that there's some of the cells that we biopsied were normal, some are not, but the majority of those mosaics, actually, a good half of them at least, are normal. So I would definitely not throw in a mosaic. We would transfer them. Good question, that is.
Yeah, so Amy Garcia canceled cycle due to bad weather, couldn't get in for the retrieval. Question is turning into an intercourse cycle. How many eggs usually will be released? Well, anywhere between 3 and 10 eggs may be released. So there's always a little bit of risk of higher order multiples, but it depends on your age and the number of mature eggs that you have. So that's always a little bit of an issue.
Sperm count, tubes, also.
Yep.
Yeah.
Yep. Sharmista, New Jersey, and seeing RMA fertility. Great place, by the way.
Yeah.
I am done with IVF. I'm an old. My dear doctor is very helpful going for donor egg route.
Yeah.
Herd CNY is less expensive. We're going there and see why I monitor RMA. Spent lots of. They can potentially do monitoring. They're a great place. We worked with a lot of fertility centers around the country and the world that'll do monitoring, so it can be very, very helpful. Let's see, Dr. Faruqi, Dr. K, a pleasure working with you guys. And cyst aspirations aren't always necessary, but they can be helpful in kind of cleaning up the ovary before you start a stimulation, for sure. Let's see, my immunology doctor sent IVIG. And the see details, send me intralipids. Mary Avbaz. Let's see. We do recommend IVIG. So I'm not sure why you received IVIG. Maybe there was a misunderstanding on both parts of what you really needed and wanted. So we can help straighten that out for sure. But IVIG is more expensive and is probably a higher recommendation. But we call that the level 4 immune system. The level 3 is intralipids, and that maybe there was just a miscommunication for sure.
Yep. There's a question there. Do we work with Shady Grove? Answer is yes.
Oh, yes. Shady Grove's excellent center.
Yeah. Actually, it's pretty simple. We work with everyone.
Yes.
There is no one we don't work with. Can you talk about Zymot? Actually, a lot of patients are asking us about Zymot. So Zymot is a little cassette.
Yeah, it allows this. It's a swim up technique essentially, and we are offering it. I think it's a few $100s extra. It may help allow the less DNA fragmented or damaged sperm to be collected for either ICSI injection or standard fertilization or even IUI. So those are things that why would antihistamine protocol? So
why would you use that?
Well, think about the cause of all disease, and infertility is inflammation. And as we get clogged nasal passages, we can get clogged reproductive passages on the male and the female side. And I know when we do a laparoscopy, quite commonly we see a lot of mucus that is collected in and around the fallopian tubes in the cul-de-sac. My sense is it's the same problem. It's inflammation, and the mucus is secreted in order to protect the system and clean it out. And so by using the Claritin, Pepsid, and Benadryl, 10, 20, and 25, Claritin, Pepsid, and Benadryl, you can use them morning, noon, and night. The Benadryl at night because it makes you a little more sleepy, along with maybe adding steroids or aspirin, that you can get some real benefits. So I would say that basically inflammation is a cause of disease, of infertility, and adding it can help for sure.
Low dose letrozole, luteal start, better choice. Low dose follicular start made 10 follicles, but not big enough before ovulation. 2 rounds of high dose made 1 follicle. So I think the situation here is we don't have a good response, probably a low ovarian reserve. Typically, low dose protocols are going to do better in that situation. And as far as luteal start or follicular start, if we had the option, we'd probably start with the follicular start because it's easier to start like that. But we can start IVFs any moment in a cycle. We typically like follicular starts, though.
Yeah, more and more we are pushing to more luteal phase, or any start date is really works well. I like to use estrogen, progesterone, and so I think it helps a lot. And I do a lot of lower dose protocols, letrozole 10, 200 of gonal or follistim, with 20 of HCG. It works,
Yeah.
I think, really,
Yeah.
really nicely. OHSS risk and hyperstimulation, 30 follicles.
Estradiol was
4,000.
4,000.
9. So we had Dostinex, we may add Lovenox, aspirin, and even letrozole post retrieval. We may recommend a freeze-all cycle and not do a fresh transfer.
Yeah, generally, we like if there's a serious risk of hyperstimulation, we prefer not transferring because then you get what's called a delayed hyperstimulation, which is you can become okay and then you get pregnant and then you get another hyperstimulation. That one is a really bad one actually, because it lasts for a long time.
Jackie Blackman, spinning sperm
For
to be gender selection.
That doesn't really work.
We have not found successful. I can't remember the name of the technique.
Well,
It'll come to me.
It was called sperm sorting. We used to do that in the early 2000s.
Yes.
It actually didn't work also. We managed to separate a little bit. Maybe we got it to like a 53-47 kind of thing, right? But nothing beats PGD.
Yeah, gender selection is best done with biopsies. What would the test to do to assess the cause of multiple miscarriages, Karen? Well, the cause of multiple miscarriages is the same cause of being infertile. It's inflammation. I do believe that it's important to do karyotyping to look for any defects in your chromosomes that a balanced translocation, which would cause an unbalanced embryo.
Yeah.
That's probably the best one. PGS testing can be used, but I don't think it answers the real cause, which is inflammation. And that's why we do a lot of immunology testing and treatment, which I think is really helpful. And the most important treatment is going to be, I think, things like aspirin, prednisone, Lovenox.
Especially if we don't find anything, I think then the immune system is probably the number one culprit here.
Well, and in fact, even if we find something, the cause of the something is likely immune issues. So if you have blocked tubes, it's an immune problem that caused the damage and inflammation to the tubes. So that's why I think the most important thing is read our family building guide, look at the immune protocols. 3 and 4 would be recommended, but don't give up, keep at it. And don't forget Kiltz's keto lifestyle. It's a high fat, low carb, no carb, intermittently eating one meal a day or less. That I think is really important.
That diet is also a very low in it's anti-inflammatory diet.
Right. Yeah. Which is why we share it, because of the anti-inflammatory nature, which is fat. That's why we give intralipids. Intralipids reduce inflammation and can be very, very helpful for sure.
And how many miscarriages do we need to have before we start investigating, Rob?
One, but even none, because even if you're not conceiving, the same problem may be happening because you just may not be implanting those embryos. So you have to, the problem is we think if I miscarry, it's one thing, and if I never get pregnant, it's another, but the causes are absolutely the same in all of that. So I would say that it's important.
There's a huge overlap.
Oh, huge. Acumash said that she's noticed more of her patients having success with FET due to the strength of the embryo being frozen than thawing out. Thoughts? Well, frozen embryo transfers tend to be better. It may be our selection bias to freezing more embryos because the environment of stimulation. It's not likely the embryo itself. It may be the fact that some embryos survive thawing and others don't, but 99% of embryos that we freeze survive the thaw anyway. Yeah. My bet is it's an environmental factor that has to do with the stimulation, or it may help us better treat the immunology side of things while we're preparing for the frozen embryo transfer.
So there's a question there. Do we recommend intralipids and HCG wash prior to FET? I have stage 4 endo, and I just had my 3rd lap. Answer is yes. I tend to be very liberal with doing intralipids and HCG. I recommend it to pretty much anyone.
PRP and HCG washes
Yeah.
can be helpful.
Yeah.
Even Neupogen wash. And then look at our level 3 and level 4 immune protocols in the CNY Fertility Family Building Guide on Amazon. Can be very helpful. It lists those protocols. You can use them, take them to anyone. We'd be glad to help answer questions for you. I think that they're absolutely very important. Sarasota location be taking patients by September 1. We were hoping before that, but it's a little tight. We really we're going to be doing monitoring, blood draws, and for IUIs and IVF and even intercourse cycles. Dr. Condrup with the team we've built already. So we're just about there, 5922 Cattleman Lane, just down the street from Doctor's Hospital in Sarasota. Here's a good question.
So Dr. Kills, my OB did a lap and found hydrosalpinx on my left tube, but my right tube is good. He put me on a 10-day doxycycline treatment, gave me the go-ahead for the transfer, but my transfer failed. What do you suggest for the hydrosalpinx?
Well,
we suggest removing it, because the hydrosalpinx is actually a tube which is full of a fluid.
Inflammation.
Yes, and that fluid has a lot of inflammatory components to it, refluxes back into the endometrial cavity, and causes problems with implantation.
So remove it, better than ligating it, but ligating if you can't remove it. But it may be a month or 2 of antibiotics, by the way, not just 10 days. And so don't discount the fact that there are some other ways to do it. All right. Ann Rollins, 30, have one healthy child in pregnancy, but that was 10 years ago. Let's see, AMH is 0.75. How bad is that? Well, AMH is a marker of inflammation. The lower it is, less than 0.5 is probably getting in the nuts really bad. Certainly at the 0.1, but we've seen turnaround with things like the ovarian bloom, molecular fertility supplements, Kiltz's keto lifestyle, human growth hormone or omnitrope can be helpful. And give it 2 to 6 months. I've seen plenty of women just like you conceive. And even with gonadotropins or letrozole gonadotropins, we've seen pregnancies with standard treatments, even with AMHs at the 0.75.
An important fact, AMH does not predict your probability of pregnancy. It only predicts your response to fertility treatments.
Right. So don't let these numbers deter you that it can or cannot happen.
No.
We've seen higher numbers not conceive and lower numbers get pregnant.
Exactly. Yeah.
Intercourse after FET, looked up online, says yes, and others say, yeah. No one knows the real answer, but it may be that ejaculate in and around the cervix or the uterine cavity may be helpful. That's why even IUI with sperm prior or sex prior to a transfer could be helpful. So I would put it in the yes category more than in the no category. When I can schedule my blood work, them CNY is having on Friday to get blood work. Hi, Amy Garcia, probably be closer to the September 1. We're getting close. I know we do want to have all our ducks in a row, as they say, before we get started for that. Do you recommend on top what vitamins? So we offer the molecular fertility male and female supplements. These are the ones that we recommend. You can get them online. Check out CMI Fertility. I think they should be all in stock again or coming in stock.
Because we had a
soon.
problem with supply.
Yeah.
Prevare
10 days to restart bleed, but it didn't work. Carissa Curry, too thick of a lining. Well, this is where I think hysteroscopy can be helpful. Birth control pill or estrogen, progesterone, 2 to 4 milligrams of estrase, 200 to 400 prometrium, and then maybe even a Lupron overlap or a Lissa overlap can be helpful in that. But then a hysteroscopy DNC, I think, could be
and if you took
good.
Prevera and you didn't have a bleed, it makes us think even more so that you might actually have a polyp.
Miracles, yes.
Yeah.
53 miracles can happen, but you really need to look towards donor eggs, donor embryos in order to really see the much higher success rates. It's not impossible, but you're going to spend time and money, and you decide how much time and money you want to put into that.
26-year-old with a normal ovarian function, normal BMI. My husband has severe MFI due to low motility and morphology. What is MFI?
Male factor
Male
infertility.
factor. Okay. How to decrease the risk of OHSS? I don't quite get the question. The male factor infertility does not affect your risk of OHSS. What really affects your risk of OHSS is your own ovarian response to the treatment. So
lower dose protocols.
Yeah, usually
do a mini.
Or also, a Lupron trigger is a really good way of lowering the risk of OHSS. As you mentioned earlier, freeze all is another good way of lowering it. So when we do all these three things, and we've now started adding letrozole and Dostinex and all that, most patients don't actually get sick like when we used to see them in the 90s and in the early 2000s. We had patients that were really getting sick. Nowadays, other than a mild discomfort, most patients don't experience much of a problem.
Much lower risk, much lower risk. But the 10-220 is an excellent protocol. It's lower cost. We think it's very effective. And I do it on a lot of diminished ovarian reserve AMHs in the 0.5 range. It can really be helpful. Is CBD oil helpful for reduction? Nahid Saeed, yes. CBD oil, omega-3 fatty acids, Kiltz's keto lifestyle. Check out the book on Amazon. We have a new one coming.
It's a high fat.
It's high fat.
Fat is anti-inflammatory.
That's how you make soap. You take fat and you take potash and you add water to potash and add fat and you get soap. Let's see. You can do IVF without HSG. You could do it without a saline sono. You could do it without any testing. You can decline all the testing. Certainly without an HSG, we do it all the time. We got 3 embryos. Next step, cycle 18 eggs and only 8 mature after birth control Lupron suppression. We only got 3 embryos. So you got 3 embryos. That may be all you need out of that for sure.
Yeah, because it depends on your age. And 88. 32.
Second IVF cycle, first cycle out of 20, and only 11 eggs are mature. This cycle 18. And I always say get rid of the only part of it, because why some people make more eggs, you want to count the mature eggs. That's really the number more than anything. But you got 11 and 8 mature eggs, and you got maybe pushing to day 5 might not be the thing to do if there were day 5s to day 3s. Look towards anti-inflammatory, look towards do a priming protocol with human growth, estrase prometrium, along with the DHEA, potentially low-dose DHEA. Check your DHEA testosterone levels. May be helpful, may not. That's a whole nother, bag of can of worms, I think it's called.
Can of worms. Just a whole other can of worms.
The answer to the Sarasota location, do an IVF. IVF in Sarasota is likely going to be January to March. We're really working on it. Dr. Condorp's already trained. We've already gotten her okay to start doing the work. So that's coming very, very soon, by the way. All right, Brandy Pierce, is there any truth to Adderall helping egg quality in women over 50? It's a controlled substance that I don't believe that there's a lot of evidence to that. And we're not using it. It has a lot more risks. And the state licensure boards are coming hard on doctors that use it. So I don't know where you're going to get it, but I have.
And there really is no evidence that it's helping.
There's conflict. People can write anything and you'll find something that says it worked. I just don't believe the data on it, but there may be something to it, but it's one of those that may be more trouble and damaging. Mosaic embryos.
Same is another. That question is similar to the one we just answered earlier. It's got nothing to do with the sperm or the egg. It's the actual embryo itself. And when we biopsy the embryo, we're biopsying the outer cell layers of the embryo. So we might be getting different cell populations, but the majority or a good half of mosaic embryos most likely normal.
Right. And
so we transfer them.
And yet the abnormal part of an embryo may be related to a bad egg, a bad sperm, or you may get a good sperm, good egg, but an environmental, as the embryo is dividing, the mosaic or abnormalities happen in its division process, which is due to the environment that is causing that. But many mosaic embryos become normal babies if they're transferred, and we've done a lot of those transferred in our hands. So,
in fact, we don't throw away embryos.
They're not ours; they're yours.
Yeah.
Right. All the labs, but not the genetic testing. Is that okay? You do not need to do the genetic testing. You could decline them. All these things may be declined. We offer all this list of stuff because people want to have it. You can do immunologic testing with Dr. Vidali, Pregimmune. We highly recommend do all the testing you want. It's going to streamline some of the treatment, but most of the treatment is still going to fall up into the same treatment bag, by the way. All right. Another question here.
Dr. K, I spoke with you over a month ago. I've been trying to schedule a lab and a hysteroscopy with you. My provider doesn't perform that, but you still haven't gotten a schedule. What should I do?
Keep asking.
And you are a busy doctor.
Well, the problem is that we're short-staffed, COVID craziness. The ORs now are beginning to even cut back on our OR schedule.
Yeah, we have another wave here.
And I just took 2 weeks, one for recovery from surgery and the one for a vacation. So these are some of our challenges, but we can help it that you can find other doctors around the country to do it.
Dr. Lutringer does that too.
Right, but the same problem with Dr. Lutringer and myself in Syracuse is our scheduling, the hospitals, and our staffing. So I apologize for that.
And to be honest with you, I have the exact same problem in Montreal too.
Same thing.
Same thing.
Let's see. I have
ADHD and prescribed Adderall. I quit taking it for the IVF process because I thought Adderall would hurt the eggs. Is that not the case? I don't think it does anything really.
I don't know that answer.
No.
I don't know that answer. I think whatever's causing your ADHD, which is inflammation, affects your fertility. There are women that get pregnant with Adderall and many that don't. So I don't think we've solved it. Is it something we should be adding to everyone in this? Oh, no, I don't know that answer.
This just reminds me of a question that we get a lot. Does COVID vaccination affect fertility? What do you think, Rob?
Current data shows that it probably does not. I don't think we have enough long-term data to answer the question. I think that the COVID virus is still worse than the vaccine.
Yeah.
We recommend the vaccine wherever you are in your fertility journey. But it really individually, you have to decide what you want to do. But I would say overall, it probably, Randy Morris at I think it's First IVF in Chicago area, Illinois, is done some studies and shows that it likely is not harmful to your fertility.
Neither for pregnancy. However, we still tell our patients to wait the first trimester. That's about it.
Yes, but that may be changing. It's open. You have to decide which way you want to go. All right, Carlissa.
I will. Keto has really helped me with my ADHD. The only reason I was able to stop taking the Adderall. Inflammation.
Yeah, and ADHD is just another inflammatory condition of the brain. And so when we really begin to understand the health and wellness of the human, all of our problems are not, they're genetically predisposed, but they're environmentally caused. And when we change our environment internally, game changer. Struggling to thicken on estrase for 2 weeks. What else can I take? Acupuncture. You can do intramuscular estrogen, vaginal estrogen, or
PRP,
or topical estrogen. And then there's PRP, Neupogen, and HCG washes that may help. And then Viagra intravaginal may help, or even oral may help. Kiltz's keto lifestyle, I think, can be very helpful. Let's see. Here's a good question, Dr. Faruqi.
How would you know if you need IVF if you've been trying to get pregnant over 10 years and I've had endo and I've had 2 miscarriages?
Latasha, thank you for your question.
Well, I mean, number one, you need to be investigated, but that's an awfully long time to be trying to become pregnant. So most likely when we're going to do your investigation, it might very well be that would be the recommendation just because of all the time you've been trying. We obviously need to look at the sperm, the oversight quantity, come up with a good solution. Generally, our solutions are always tailor made to the patient's uh,
Absolutely. Absolutely.
demographic. There's no one solution fit all type of thing.
Although the one solution that fits everyone is you must have faith and change your diet and believe in the outcome you desire. And that's a good question, Latasha. If you look at our family building guide, a lot of information that'll help you conceive and stay pregnant naturally, if not with IUI or IVF. If you have endo and have had a laparoscopy, this is where low-dose naltrexone, LDN, CBD oil, and keto can be very, very, very helpful. And our basic immune protocols, Lovenox, aspirin, prednisone, LDN, and intralipids, may be all you need to help you stay pregnant. Kiltz is keto. I'm mostly carnivore. That's my general recommendation. A vegan vegetarian is harder. There's a lot more phytoestrogens, phytoandrogens, and plant phytochemicals and antigens that adversely affect our fertility. So that's why we talk a lot about this. But IVF certainly may be the route, but we're CNY fertility. We're not here to push IVF on anyone. We want to help you understand your options before you jump into any of them. And if you look at the Fertile Feast, the Family Building Guide, and also Kiltz's Keto Lifestyle, there's a lot there that can be very helpful.
At consultation, I was told I'm too young to transfer two embryos. Why? Well, first of all, we don't have a rule like that. What we're trying to avoid is multiple pregnancies. At the same time, we're trying to maximize your chances of pregnancy. So it's a balance between how many embryos we transfer versus your chance of pregnancy. When you're young, and if you have day 5 embryos, they tend to be extremely fertile. So we try to avoid putting 2.
And we want to minimize multiples. And so at 30, the first, second, maybe even the third transfer is 1. Then we might be talking, depending on quality and failed cycles and whether to go to 2 embryos.
Yes, exactly. But it's a very much a decision that you make with your doctor.
Be better than your yesterday, every day, by the way. Thoughts on human growth hormone Omnitrope? May help with sperm and egg quality. Maybe we should be using it more on the guys. I think we've probably fallen short of that. Don't forget the molecular fertility essentials for male and female, the ovarian bloom, and Sarah Vital is an oral over the counter. There is the Somaderm, a topical, and I think Dr. Fink can help us with some of the other human growth hormone that are available also. All right, here's a good one, Doctor.
Egg retrieval last Monday, 4 mature, tried to be fertilized. We thought we only had 2 that fertilized. Decided to freeze with a possible second retrieval next month. We would eventually like 2 children, 3 embryos actually frozen, grade 4, 8, 3, 8, and 3 greater than 9. 1, 2 p.m. Now wondering if we should go back for a second retrieval or attempt a transfer first. I'm 35. AMH is good. 1.5. FSH is fine. Fiancé sperm is almost 100% ASA.
Anasperm antibody affected.
Okay. And I'm worried about DNA fragmentation. Looking for your recommendation.
Cindy Timmons. So
it's the question is a very big question. We can actually measure the DNA fragmentation. It's a test. We do it. If your DNA fragmentation is high, supplements. Do you have that here? The supplement?
Yeah, we have the male. So the male supplements.
Yeah, this one here. Now it actually really does work to reduce DNA fragmentation, because the biggest cause of DNA fragmentation is oxidative stress to the sperm. These are antioxidants.
All these things may help reduce inflammation and may reduce the damage from DNA fragmentation. And we highlight the may part of it, by the way. And so, but absolutely. So, and what about keto?
Well, it's got the same effect. It's reducing inflammation, whether it's by oxidation or by any other mechanism. Whatever you do to reduce inflammation is going to help. We talk a lot about diet, but I think for most people who hear us talk, I think a lot of our patients underestimate the effects of diet in fertility.
Well,
It,
all disease, all disease.
but we see it. We
Yeah.
really see
Huge,
it.
huge.
Yeah.
So the question whether to do a transfer or go to another retrieval, it's really individually defined.
Yeah.
Banking more embryos is never the wrong thing. Obviously, it would cost more money and emotions and injections. So I think you're not wrong in banking more embryos. And a one pronuclear stage embryo, by the way, can be a completely normal embryo. You got to be careful of the grading in those sense, but I would say that you should be good to do either one.
And one thing to consider, you said you're 35. If you get pregnant, actually, when you get pregnant, pregnancy lasts 9 months, you're going to have a newborn baby. The chances are you'll be back in approximately a year and a half or 2 years after your baby's born. So now you'll be 38, maybe even 39. So there could be a rationale there if you wish to have more children to start banking embryos.
So banking is always a good option if you're ready in many other ways. So gender PG pre-implantation genetic testing.
Which test is
it's the PGT testing for gender.
That's the only one that's reliable.
Yep. Male, can a male give multiple semen samples days leading up to an IUI if low motility? Brianna Marie, yes. Yeah. Yep, we could freeze them. We often will bank sperm for many months, for sure.
Oh, I got a question for a Kenyan patient over there, Rob. Can I go to Montreal Clinic from Markham, Ontario, if I'm not vaccinated? Of course you can, but I don't know if you really need to go to the Montreal Clinic. We have places in Ontario where we can take care of our patients. So CNY Canada is active in Montreal, active in Ontario, and remotely, we have patients all over Canada. We have patients in Vancouver. We have patients in Halifax.
All over Canada.
Pretty much everything.
All over Canada, all over the globe. Yes. We'll take care of clients from everywhere. But yes, you can go to Montreal for monitoring. Dr. Fruki's team will get you in the system, help you get your medications, and help move you forward quickly. And that'll be really good.
But a lot of this traveling can actually be avoided. We have a lot of connections. We can help our patients.
But they want to come see you directly. They want to come visit the clinic.
I'm also in Ontario. I'm also in Toronto.
Which office are you at in Toronto?
Well, our partners are at New Life.
Okay, so we work with New Life.
New Life in Toronto. That's a really big IVF setup in Toronto, one of the biggest ones.
Does keto diet help with endometriosis, Webster? So endometriosis is a bowel inflammatory disorder. So when the bowel gets inflamed, it damages the pelvic peritoneum, it damages the ovaries, the uterus, the tubes, and everything. So by going keto, one meal a day, Kilts is keto, high fat, low to no carbs, but that one meal a day really matters. And minimize the carbs. To me, you always want to cook a carb, no raw carbohydrates. Seeds and nuts, fiber, fruits and vegetables are very deadly, I think, to the human being. So you don't need to be vaccinated. I would think that was the other question.
There's
there.
Nobody checking there's no checking.
Sherlyn, good morning. How are you doing? And
morning.
And there's so much success out there. Keep sharing your successes, by the way. The more we share successes, the better. Share the things that are challenging, that how we can all help to do better. My global team, my travel team, thank you. We're really working on our financial team being better, growing the team. So we're really excited about that.
Silvana again. All you have to do is ask someone at the nurse or the doctor taking care of you to task us at CNY Canada. We'll help you out in the GTA. There's multiple clinics where we can help you there.
Yes.
I am 39 years old. I have a tumor that produces prolactin, but it's controlled. Likely the question is, does that affect my fertility? As long as we're treating it, the answer is no, right?
Well,
except if it's bigger than a.
Well, the prolactinoma, even a microadenoma, may adversely affect your fertility. So you want to get it treated either with Dostinex or Parladel, and make sure you've had the proper CT, MRI to make sure you don't have a macroadenoma, which might need surgical intervention. but you want to get treated and make sure you're talking to your endocrinologist or neurosurgeon who's ever helping you take care of that. But it can be a factor.
But just to reassure you, macroadenomas are actually quite rare. Most are microadenomas.
Right.
Those don't need surgery. They're treated with medicine.
Yes. Right. 8-week loss, first FET, record transferring next cycle or skipping a cycle. Well, this might be where you want to stop and reassess. Have you gone to check for endo or treated endo? Are you doing complete treatment for other inflammatory conditions? Might you have a hysteroscopy DNC? Do ERA testing? Do a month of the antimicrobial antihistamine and maybe even 2 months of the anti-endo treatment. That can be very helpful in all of that. So
in essence, it's worth looking at your chart and double checking everything.
Right. Reviewing your history, talk to a practitioner, all the things. It may be just another embryo. That's all we need to do is change that. But I think we want to look dig deep. And this is why whenever I do a follow-up, I'm starting from the beginning. Your years of trying, any pregnancies, any babies, your age factors, and any other medical conditions that may be a factor. Which IVF would be best for a couple with no ovulatory issues, only dealing with male factor less than 1%? Brianna Marie?
I'm presuming you're asking the question whether it's conventional IVF or ICSI. So the answer is ICSI.
Yeah, IVF with ICSI is really our pretty standard in all of this, where we inject sperm into the egg, which I think that's kind of what most people have gone to.
Yeah, I mean, I'd say 95% of our cycles are ICSI cycles. The other thing, that would be a good case to see if you want to consider Zymon. And see if we could pick out the best sperm.
And it depends on the motility, because you have to have motile sperm with Zymon.
Yeah.
And so that might be a little bit of an issue, but again, multiple samples may be helpful. Treatment that can help male factor and fertility. Well, again,
supplements there.
The keto diet, the supplements, low-dose naltrexone, CBD, the CBD oil, as I mentioned. And varicocele repairs may be helpful.
Yeah. So past the supplements, we can investigate male factor infertility. There's testicular ultrasounds. We do blood work, testosterone levels, FSH levels. Based on our results, we can come up with, if we find a varicocele repair. If not, there's medication we can give you, letrozole to men, Clomid to men. All these medicines can affect in a positive way sperm production. So it's definitely something.
We do male factor consultations. Yes. We can order the blood testing, the ultrasounds, and review all of that.
And male factor infertility is 50% of infertility.
Yeah, well, I always say it's 100% male, 100% female. You got to always keep in mind and don't ignore any of them, but do a thorough evaluation. Let's see. There was a good question here. Black Love Beautiful. How long should I prime before IVF? Possible diagnosis of endometriosis, adenomyosis. So at least 30 days is good. 2 to 4 weeks. 30 days is good.
2 months is usually our go-to number.
Yep. So I would, again, keto. Look at our family building guide. Lots of really great stuff there. And change your diet. Add the LDN. That's a good one where you might do 2 months, even 3 months of either Orilissa letrozole or Lupron letrozole, which will help reduce a lot of that inflammation for sure.
Can you please explain the benefit of assisted hatching? Can you tell us how do we do assisted hatching?
Well, hatching, basically the embryo is surrounded by a shell, the zona pellucida, and the embryo has to actually get out of that zona in order to implant. The assisted hatching is a technique where we either use a chemical or a laser or just cut a slit in it that assists in the hatching, as a failed hatching may be one of the culprits and the causes of failed implantation or infertility. So, it's kind of one of our routines now. If we're doing IVF,
we do it for everyone.
We routinely do it. There's no adverse effects. It's not a high charge in doing it. We just don't know how much it's really going to help you in this.
And we do it without extra cost to our patients. There's other clinics that actually charge for that.
Well, it's a nominal charge. It's built in for the self-pay. There's a little added cost for those who have insurance if they don't cover it. So it's something to talk to our team about, but it's something we believe everyone should get.
What's the dosage of human growth hormone to take for male factor to improve the sperm? I honestly, we've been talking about that. We haven't been
empirically 6 to 8 maybe enough. I do a lot of lower doses of 3 units. Kind of the same thing with the eggs.
But let's not forget that if you do any treatment for male factor infertility, you have to be a little bit patient to see the results, because the sperm that we collect today was actually made 60 to 90 days.
3 months ago.
3 months ago.
Yeah. Real important.
Yeah. So if we start about treatment, you won't see a change in 2 weeks. You'll have to wait. That's our last cycle.
Let's see.
Ectopic pregnancy.
Caragina.
Yes. So our last cycle resulted in an ectopic pregnancy. We did not do methotrexate. My local OB monitored us through it. How long until we should try again? HCG is now 0. Now is the time.
Yeah. Once it's down to 0, essentially.
One more thing. When you do get pregnant again, you need to come report as early as possible that you had a history of an ectopic pregnancy.
Yeah, so we'll monitor it closely, because we do monitoring close for everyone. Because we want to support the pregnancy. Let's see. How can you improve abnormal chromosomes? Well, again, fish shows 40% abnormal chromosomes, no issues with mobility, quantity, or fragmentation. So abnormalities are shown in lots of different ways. And abnormal chromosome sperm, fish, well, my bet is that there are a lot of sperm and eggs with abnormal chromosomes, but I'd say the same treatment, the male and female supplements for egg and sperm, the keto lifestyle for male and female, low-dose naltrexone, CBD, acupuncture, massage. Get off the treadmill, slow it down. You want to cool the body down. That's really, really, really important for everyone, to cool the body down and slow it down. All right.
Okay. I'm 35 years old. I have one child, which he was conceived naturally 15 years ago. I've been trying for 10 years with different partner.
All tests
came back normal. AMH is 3.6, which is good. Slight male factor. Morphology is 76%. I have a consult next month. Can I have a laparoscopy at retrieval, or do I fly out before? What else should I do? I failed 3 IUIs.
Sarah Grizzle Lapline. So I would say that the laparoscopy, hysteroscopy is separate from the retrieval. Just not that it can't be done and hasn't been done. It's just too difficult to time it, unfortunately. We recommend ahead of time. You have a good AMH. But even with IVF, you don't necessarily need the laparoscopy, hysteroscopy anyway.
And failing 3 IUIs it doesn't mean that your IVF is not going to work. It's a completely different treatment. The pregnancy rates with IUI are what they are, but with IVF, they're significantly higher.
Let's see. A double trigger. Some people may not respond to that first trigger with Lupron only. So we've had the second one, but those are mostly people with very low LHs. And so that second trigger is helpful. We tend to just do it for everyone or most people, but one HCG or a single Lupron with an HCG or an HCG and a double Lupron. We have lots of different ways to do this. The one isn't better, but in general, if you have a very low LH, less than 1 at the time of trigger, then you adding the second Lupron we think is helpful. And in those cases, you probably should add an HCG trigger, which you have to be a little more careful about because there tends to be a little more hyperstimulation from that. Brianna Marie again. How quickly can acupuncture improve fertility?
Motility. Well, the same thing. If you do anything that changes the sperm positively or even negatively for that matter, you have to wait a little bit to see the effect because there's a delay.
So I'd say that yes, Zymot Pixie can be helpful for improving the abnormal sperm. Most of the time, if you're infertile and everything looks normal on the female, normal on the male, there likely is some abnormal sperm and eggs that we just can't see, or again, that inflammatory environment, which is a factor. Mesh couture.
Yeah. IVF resulted in a chemical pregnancy. How can I prevent this from happening? When can we try again? First of all, we can't prevent an chemical pregnancy. What had really happened here is probably that the embryo implanted but did not continue developing. In a way, it's a good thing because it tells us that you're able to have an implantation. You likely have a good implantation window. It's not preventable short of us using progesterone and things like that we do for everyone. And when can you try again?
Well, there's our immune 3 and 4 protocols and our keto, all these things, a laparoscopy. So these are things that we'd say, aha, we do know that something can happen, will happen, even if you're getting all these negatives. Again, it always goes back to the beginning. Inflammation, immunology treatments, anti-inflammatory diets, low-dose naltrexone, CBD, acupuncture, massage, and don't forget faith. You want to put the vision board of what you desire as if it is. But absolutely, this is a signal that it's trying to happen. Yeah. We just have to help get it to the next level. And that's what this whole story of CNY fertility and the family building guide is really here to teach, that you can have it happen naturally by doing many of these things without doing the surgeries and things like that. So do not give up. I think that's our number one, isn't it, Dr. Faruqi? Yeah. How about this one, Doctor? Heather Owens.
Yes. So my first FET, frozen transfer, ended in a chemical last month. I had 3 positives on day 5, 6, 7 with PGTA normal embryo. I was started on transfer procedure with no washes. I have 2 embryos left. What do you recommend? Well, it's the exact same thing we just talked about. Washes.
Yeah, HCG, PRP, Neupogen washes.
We have intralipids that if you didn't do that, we would recommend that. You have 2 embryos left. There's a pretty good chance you will get pregnant. And we might want to review your chart again, see if there's something else, perhaps an immune protocol.
But go to the family building guide, tell the nursing team you want to do either the level 3 or level 4 immune protocol, read it thoroughly. Amazon, you can find the family building guide, get a printed copy or digital. The answers are right there for sure. We see, and just because it's a PGT tested embryo doesn't mean it's normal either, but it does increase the odds of normalcy for sure. Brittany Robinson, what would be your treatment plan for someone who is with 1 tube but no fertility issues?
Normally that should not affect your fertility a lot.
Well, you have fertility issues if you're not conceiving, but if there's a male factor and you're doing IVF, we always want to make sure we're using a global approach to this, whether you're doing it for gender or you've had a tubal ligation or vasectomy. Just family building guide, download it, get a paper copy, read it thoroughly. Lots there. Talk to your OBGYN doctor, talk to your fertility doctor, how you can improve and reduce the inflammation in your body, which is a culprit to all of our diseases, by the way.
Yeah, and IUI can work with 1 tube, by the way.
All day long. Yeah. And even natural fertility can happen
absolutely.
With only 1 fallopian tube.
But like I said, you can still do keto. You can do a whole lot of lifestyle changes to help you regardless.
Which is helpful for your overall health and wellness. And I'm telling you, I had my triple hernia repair robotically by Dr. Sartoria Kraus last Tuesday. The Kraus surgical team, the nursing team, the technicians, everyone there did an amazing job. I'm really grateful to them. But it really is important. You have to take care of yourself. And for me, it's staying Kiltz's keto lifestyle. It's that 1 meal. If you're going to do exercise, light weights, light walk, light riding, don't overheat the body. And that's really, really critical in all this. So 10 days of duostim and not responding, either keep going up the dose or give it a rest and restart in a week or two. Those are things that can be very helpful for that, right?
Hey, by the way, someone's asking, how did you get the hernia?
I'm 65. Over time, our bodies get damaged. And for me, I've had these hernias for a long, long time. I had one repaired about 5 or 8 years ago, but a new one was popping up, a little more painful. It was there, but it didn't start nagging me. And so over time, all of our bodies will decay. And Kiltz isn't, Dr. K isn't immune to that either. But I can tell you that I stay healthy. I work on my health and wellness through the things I'm teaching that I personally do myself every single day. Did we get this one already?
Yep. Stephanie
yes.
Pelletieri. I'm 30 with PCOS. I failed my first FET with a 4AA embryo and an HCG wash. I haven't had a saline infusion sonogram, that's SIS, or ERA. I have 10 well-graded 5, oh, that's really good, 10 blasts, wow. Do you recommend doing SIS or ERA before next transfer, or is it reasonable to try another FET? You could go both ways, but if you're asking the question, I think I would, at the very least, recommend an SIS.
Well, all the things you do that will help improve your odds.
Yeah.
So it's like, oh, we'll do one or two, and if it fails, then we'll do these things. Yeah. Here are all the things you can do. You choose them. Just again, look at Kiltz's, look at the family building guide. It has the checklist. Go down it. If you look at the cost and intervention, you don't want to do it yet, that's fine. Yeah.
But a saline infusion is not expensive. It's easy to do. ERA is a little bit more expensive.
But add the scratch in and of itself. I think hysteroscopy DNC over an SIS. SIS is looking and saying, oh, it doesn't look like you have anything, but you haven't done anything to improve your odds. My take on thing, whatever we can do to improve your odds is doing something, not just looking and saying nothing there. So hysteroscopy DNC scratch, with or without the ERA or the ERP, I think are reasonable. And then adding at least the immune 2 or 3 protocol, because you're doing IVF. You're likely doing it because you failed to get pregnant naturally, which means at least immune 3, in my opinion, if not the immune 4, which the 4 adds IVIG and Humira.
And also don't forget, every time we transfer an embryo, we put in the best embryo. So as you're going down your list of embryos, we're getting into the less and less. But be careful, the grading is not that great either. So just things to keep in mind.
Yes. Lightweight workouts at Silvana and stay strong. Continue keeping the mitochondria. The mitochondria are mostly damaged by too much exercise and too many carbohydrates, and eating 3 to 6 meals a day.
Carbs are poison.
They're carbocaine, I call them. They're deadly. Yeah. All right.
But here's a question right there on the left. Jeanette Dowell, 42, I have PCOS, overweight, unknown infertility after fibroid removal surgery. Well, it's back to the carbs.
What's the foundation? Kiltz's keto lifestyle, 1 meal a day. Plenty of women at 42 will have a baby naturally. Fibroids and metabolic syndrome, which is prediabetes, also labeled as PCOS, is not due to your weight. It's due to the food in your belly. So the food in your belly is digesting. It's not only creating fat, which is a survival mechanism, by the way, but it's also secreting all the toxins throughout our body, which causes every disease, including cancer, Alzheimer's, dementia, and infertility. It's a game changer.
Hey, good morning from Southern California. Now, Rob, you're from Southern California.
I'm from Silver Lake. Born and raised Silver Lake, went to John Marshall High School, LA City College, USC, then UC Davis, and back to LA for training.
And there's
Yandre.
Just above that is a good question also. Can we damage healthy eggs because of PGT testing? I think what you mean is healthy embryos. I don't really know the answer to that question. We used to test the embryos on day 3 in the past. That we did find that it damaged the embryos.
Could damage the embryos. It's a low likelihood.
But what I think we end up doing more harm is we test the embryos, we find them to be abnormal, and then we throw them away. That's probably worse because now we're throwing away potentially children.
Yeah. So a genetic testing of an embryo isn't an absolute; it's a possibility.
Yeah.
Hey, Stephanie Pelletieri, how you doing? Again, thank you to everyone for joining Dr. Fruki and I. He's going to be working tomorrow. I still may be light tomorrow and the rest of the week. I may do some calls. Miss Tia's taking excellent care of me. And you guys need to take excellent care of yourselves. Remember, you are the most valuable, irreplaceable, and expensive entity. Always see God within each and every one of us and know that the spirit is flowing through the electromolecular energy of all things. And so each and every day, you have to go slow and easy. So again, let's see. We're opening up Sarasota within the next few weeks. By September 1 is the number. And then IVF will be coming later. And again, Atlanta, Buffalo, Syracuse, Rochester, Albany, Montreal. Let's see. Dr. Ivanov in Philadelphia. We're really grateful to everyone. We're working to our very best. Our laboratory teams, our global teams, financial, but most of all, to all of you, thank you for being part of the CNY fertility journey, helping make it more affordable and accessible to everyone, and sharing the vibes. And yes, Southern California, I'm working on it. God bless you guys. See you next week. Bye-bye.